Hello, I'm Dr. Mark Spurlock and I work at Renewed Vitality. I'd like to tell you a little bit about my own personal story. When I was in high school, I applied for the 6-year medical program and I was accepted. And I started school there in 1977 and I finished college and med school in 6 years. Graduated in 1981 and then finished my family practice residency in 1984. And I did that because I liked a little bit of all of medicine. I didn't want to specialize in any one specific thing. When I finished residency, I then did 3 years in the Air Force as a family practice physician. As I left the Air Force and opened my own practice, the hospital commander said to me one day, "Mark, if I was to open my own hospital, you'd be the first doctor I hired because I love the way you take care of your patients." So then I opened my own family practice. I got to learn a lot about hormone depletions and infections dealing with HIV patients, and I got to learn a lot of stuff that other doctors hardly ever get to learn. In 1994, I left Shreveport and moved to Dallas, Texas to join the family practice group. At that time, I needed to get a lot of continuing medical education hours, and I went to Las Vegas to the American Academy of Anti-Aging Medicine. It was an amazing conference that I'd never heard things like this before. The very first lecturer said to us, "Doctors, are you doing everything you've been told to do and it's not working?" We all raised our hands. At that point he said, "You weren't taught everything you need to know in medical school." He began to teach us about nutrition and supplementation. I learned a lot of things at that conference about how to get to the core problems of your patients and to treat them with simple protocols and not just to treat their symptoms. This began to totally change the way I practice medicine. And after a few years of doing this work, I decided I needed to leave family practice and focus on these particular protocols. After that, in 2005, I started to work for the Fibromyalgia and Fatigue Centers of America here in Dallas. And I quickly learned from Dr. Kent Holtorf, a genius in the work of chronic fatigue and fibromyalgia. At that point, I got so good at this work that they made me the trainer for all the doctors in the company, and I was a Southern regional director. After working there for 5 years, I left and opened my own practice. But I decided that instead of just doing chronic fatigue and fibromyalgia work, I was going to do some additional work, because some people didn't need that level of work. Some people needed just hormone replacement, viral illness treatment, or heavy metal toxicity chelation, and I began to do that work also. What I am is a doctor detective. I dig really deeply to figure out what's wrong with you, since you haven't been helped by the doctors. I have to go deeper. I start that by doing a fairly intense physical exam. I ask you all of your symptoms. I ask you about your family history, your exposures, your toxicities that you've accomplished along the way, and then we do some very comprehensive laboratory testing. The patient returns after that to their second appointment, in which we go over those in detail, and we begin our treatment program, which includes treating these core problems as opposed to just treating your symptoms. What we really try to do is get to the root causes and eliminate the symptoms. Our goal here is to work with our patients in a 50-50 partnership to return them to a previous state of better health and not treat symptoms with just medications.